We are in the last section of our first day's inaugural webinar series, and we have here with us today Neha Joshi, who is the social sector specialist at the Ministry of Petroleum and Natural Gas, working with the Government of India. She has been a consultant, senior social sector specialist. She had been working with on gender specialist with Government of Uttarakhand. She was a program officer with Panchayati Raj institutions, and she has done her masters in social work from Washington University. Talking with her is um, uh, is Pratiksha Ghildial. They are in conversation with each other, and they would be talking about the role of media in the COVID-19 situation. Pratiksha is a senior producer reporter at BBC News, and she has been a associate producer with TV Today Network and Aasta and Headlines Today, a news editor with BBC News Washington DC, and then senior producer. And she has done her masters from University of Westminster. So they are in conversation today with each other, and they would be talking about the role of media in India, as well as about how it was in the West, because the COVID-19 situation. So, and we would like to know more about the comparative study of both the scenarios, because it's a pandemic, global pandemic that we are talking about. So over to you, Neha and Pratiksha. It's all yours now.
Thank you so much, Chetna ji, and thank you for having me here today. And it's lovely to be speaking to Pratiksha. I know she's from Dehradun, so it's always lovely to connect with people from my hometown, also from Uttarakhand. So I'm glad to be doing this today. And Pratiksha, if you don't mind, I'll get the ball rolling with I was reading some of your articles that you wrote during right at the beginning of when the pandemic was sort of starting to gain momentum. In you traveled to Spain around that time, and you were there right at the beginning of the lockdown in Spain when the virus had actually started spreading really bad there. Do you want to talk a little bit about what you saw, and then we can probably go on to how were things in India then?
Sure. Thanks, Neha. So this was in the middle of March when the reality of coronavirus had just started dawning upon India. There were a few cases. People were talking about it, but it was nowhere in the forefront of the national consciousness like it was in Europe. Because at that point, Italy and Spain were really badly affected. In fact, Italy was the worst affected country in Europe. And second worst affected in the world. And Spain was the second worst affected country in Europe. And I had actually been having this conversation with my colleagues, with my husband, with my friends, as to what India's response will look like if COVID were to hit India in a major way. And we all thought that, it could really be a disaster because of our uneven healthcare system. We have private healthcare, which is really good, but it's expensive and it's not accessible to millions of Indians. And the government healthcare is not that great in terms of the facilities they provide and the number of people that try and avail it. So we were in the middle of that conversation as journalists, when I got a call from my boss, who asked me if I could go to Spain, because Spain had just begun a very strict lockdown. It was one of Europe's strictest lockdowns because they had suddenly had a spike in cases, and it was going out of control. And I said, yes, I will go. I mean, as journalists, we go wherever there's trouble. So I didn't have any second thoughts about it. So I got on a plane and with hand sanitizer and masks in tow. But when I reached Delhi airport, I saw that, people were not really so bothered about, I mean, I guess they did know there was a global pandemic doing rounds, but it was nothing like what we see now, where people are wearing masks and are maintaining a distance from each other. It seemed fairly regular at the Delhi airport, which was in stark contrast to what I saw when I reached Spain. When I reached Madrid airport, it was eerily empty. There were very few people. We were asked to socially distance. And the moment I got off the flight, I wore gloves and, I wore mask in the flight as well. There were questions. There was no social distancing in the airplane itself. There was a pregnant woman sitting next to me who had warned me that she might feel sick at some point. So I was prepared for that, and I kept talking to her, and she very carefully had brought her own food from home because she did not want to eat airline food because she wasn't sure whether it's a good idea to eat communally prepared food. And I thought that was really wise of her, and I thought maybe I should have done the same. But then, you don't think about these things when you're in the middle of coverage. So, when I reached Spain, I realized that there was a complete shutdown. Everything was shut, and this was my first time in Spain, and it really shocked me because I had never imagined that my first visit to Spain would be like in such weird circumstances. I'd imagined that it's a city of bustling cafes, tapas bars. It's known for its like really vibrant cultural life. But what I saw was completely different, and it was weird, but so I it took me a day or two to adjust to this new normal. And we would go out. I was with a team of 3 other people, and we would go out every day and film outside hospitals and outside places which were really badly affected. And the really common refrain that we heard everywhere was that they were really struggling with their healthcare system. They were overwhelmed. And this was like really surprising for someone like me who belongs to India, because you've always heard of Spain as this country having a great healthcare system. It's one of the best in Europe. And I was like, if they are struggling, imagine what will happen if this hits India. They were really struggling. ICUs were overwhelmed, just because of the sheer number of patients who were coming. And there were, healthcare workers were like talking about the lack of PPE and the lack of protective equipment for them. And never in my wildest dream would have I thought that a country with such advanced healthcare system like Spain would struggle. And at this point, if I may ask, to play a video which shows one of my reports from there, which was like, I think just the first day I reached there.
Here in the capital of Spain, people have been told to stay at home. Emergency measures are now in place. People have been told they should not venture out. They can go to work. They can go to get food from superstores. They can go to get medicines. But only a limited number of people are allowed inside the stores at a time. Yesterday, I was walking down the streets of central Madrid, and I could see very few vehicles on the road. Public transport is still working, but only 1 or 2 people traveling in buses around the streets of Madrid. Here, just right behind me, is the Parliament building of Spain, but it's shut down. Lawmakers have been told to stay at home and continue doing that for 15 more days, which is until when the emergency measures are in place. They could be extended depending on where this virus goes, how many more new infections are reported. At the moment, we are told the number of people infected in Spain is over 9,000. Today, we are told that Spain will move to restrict entry inside its borders or limit the number of people who are coming in. The government of Spain has also enlisted the help of private hospitals, asked them to take take COVID-19 patients in to ease the stress that has been caused to the government services here. When I was walking down the streets, I could see a lot of military, a lot of police people trying to enforce these emergency.
So as you saw in that report there, the country was completely overwhelmed and the healthcare system was struggling. This was at a time when there were like almost 800, 900 new infections, new deaths actually every day. And it was quite alarming for a country like Spain, which is not used to a disaster like this.
And I think you're right. I think in the initial days, I remember I took my last flight in the first week of March. And I remember things being, absolutely, it was business as usual at the airports. I saw a few oddballs wearing masks, but that was really an exception at that point. And I think what everybody was thinking was that what if this hits India? There was that apprehension because, with countries like Spain are struggling and the Europe is struggling. But I think it also gave us a little bit of time to prepare. The government, even though the general public wasn't really thinking of it, but I think that the government was thinking that with international travel and thousands of flights that land into India every day, there was that possibility of the virus spreading. And, I was reading a report, in fact, where there was a comparative analysis of how different countries did in terms of just the, how the virus spread. And it was interesting that in the first 80 days, the United States had about 5 lakh cases. Of course, they didn't really observe any sort of a lockdown there. And Italy had about 1.78 lakh cases. Spain had 1.98 lakh cases. Whereas in India, in the first 80 days, when really the first case was detected in in Kerala, 60,000 cases in the first 80 days. So that is really remarkable. And I think there are several theories, of course. Nobody can really point a finger to why that has happened. Some say, the virus is mutating fast and, the kind of the way it's interacting with the genes of Indians is different. Some people are ascribing it to the BCG vaccine that every Indian compulsorily sort of takes. So there are various theories floating around. But I think it just the fact that this virus is so unpredictable and nobody really has been able to zero down on, there's no, in terms of the target population, it has really crossed all sort of social and class boundaries, even in terms of age. If you look at the people dying, earlier we saw more elderly people with comorbidities succumbing to it, but in the recent past, and I was looking at data from India, it's pretty confusing because the people who are dying, some of them have been really, really young. But what I want to ask you is that in Spain, this is a developed country with an advanced healthcare system and a great social security net for most people. So, access to healthcare really wasn't a conversation that I think the Spaniards were having before coronavirus. How do you think that is going to change going forward? Because, the definition of access to healthcare is going to change going forward.
You're right, Neha. It was a big shock to the nation as a whole because, like I said, they had never experienced it. I mean, the whole world has never experienced, at least this generation hasn't experienced anything like this. But of course, it was a shock to all the health workers that we met there because, like I said, it's quite a robust healthcare system, but they were really struggling to cope. One day we met and interviewed this ambulance driver who was visibly shaken and visibly really scared and said, I get, during his shift, he gets calls for like emergencies. Like 90% of those cases are coronavirus cases, and they wear their protective equipment with, the hazmat suit and the visor and everything. But he's like, we are still so scared in case someone accidentally coughs in their face or spits on their face, and that's when or if your suit rips, because that would also happen sometimes, and that's really scary. But what was really heartening was that I saw a nation that truly came together in a time of crisis. Spaniards were really, really trying very hard to comply with the lockdown, even though they are used to a very, very vibrant social life. They all love going out, they love going to cafes, to bars, but they really, really made an attempt to comply with the lockdown. The lockdown was so strict that people were not even allowed to go out to exercise. Children were not allowed to go out to play, which is quite strict. But they tried and complied. And when I was on the streets, and you would see a few people going to get their groceries or medicines, they would always smile at you, and you could see that they were being brave behind that smile. Everybody was doing their bit. There were young people who were making masks for healthcare workers, for elderly people. There were people making homemade visors, to send to health workers. And every evening at 8 p.m., people came out on their balconies and clapped for their healthcare workers, which was a really nice moment. And actually, I did that too every evening whenever I could, when I was not working, because it just felt really nice. It was a moment. So I mean, it was a big national calamity, but I think it is in calamities that the true character of a nation reveals itself, and I think that's what happened with Spain. And I really thought that they really tried their best to come together. It's one of the worst affected countries. Now, thankfully, they're on the mend. I think for the first time yesterday, they have not had a new case. So, here's hoping that they are truly on the mend.
I mean, this is, you might sound as facetious, but did the Spaniards learn anything from the flu like 100 years back? Did you find people talking about it, about having been through, was that part of the conversation? I'm just curious.
I think, it's tough to say, but I think they were so focused on the present that, everything, all their resources, all their imagination was just focused on dealing with the current situation, especially, there were some really heartbreaking conversations we also had during our interviews. For example, when we interviewed this nurse on Skype. Obviously, we couldn't meet her. She was recovering from the virus herself. She obviously contracted it during her, working at some hospital, and then as a result, she ended up giving it to her family, like her boyfriend and her kid. And they were all recovering, but she said the situation was so dramatic and the ICUs were so overwhelmed that they had to really prioritize who to give the ventilators to. So, for example, if there was a choice between giving it to an elderly patient who will not recover, and to try and save a young life, then they had to prioritize that. And that was really heartbreaking for them. It was something that they were all emotionally struggling with, but they realized that that's the need of the moment. So it was those kind of conversations people were having with each other. And I think it was a really difficult moment.
I think what you said is very important, that this is an unprecedented kind of a crisis. This is not a flood. This is not an earthquake. This is a kind of disaster where you have to be together, but also practice social distancing. You can't be with your loved ones. To protect them, you have to be away from them, especially for healthcare workers and all kinds of frontline workers. And I feel that, the part about the nation coming together, that has really emerged as the biggest learning, at least for me. I think even in India, what I saw was that a big reason, of course, there's the strict lockdown that was implemented. A lot of people in the media have been very critical about it. But fact of the matter is that in the first 80 days, India was really sort of, the curve wasn't as steep as other countries. And given our population, I think the whole world, I still remember every time, the WHO chief would come and brief, the focus would be India. And everybody was looking at India because India seemed like a ticking time bomb. But now, almost like the third month into the lockdown, I can say that we have been able to contain it. But what you spoke about, I think that narrative of people coming together, I feel it's so important for the media to highlight and focus on that. When a country like Spain struggles with healthcare, and you compare it to a country like India, where it's 1.3 billion plus population, we didn't manufacture even one PPE kit. India did not have even one facility to manufacture PPE kit. We never thought we were going to need them. We were used to import whatever PPE kits we were using. And today we are manufacturing 5 lakh PPE kits in a day. So, this lockdown really has been, it's been a shock for the economy. It's been an extremely tough time for most of the people. In terms of accessing basic services, and even I think psychologically, it's been a trying time. But it has also been an opportunity. And I think in India, I see an example of a country where it has really jolted our collective consciousness. And it has really also shown us what the government is capable of if it really wants to do something. Have you heard any of these comparisons in the global media, since you're more tuned in than probably I am?
Right. So, I agree with you, Neha, that initially India did a relatively good job of containing the virus. Of course, now it's becoming a little more serious, and it's thought that, the peak is yet to come, maybe in July or August, and maybe things will be much worse then. And we need to be prepared in India for, again, overwhelmed ICUs, not having enough beds in the hospital, which is a reality in India.
Already experiencing it.
Yes, yeah, exactly, and it may be about to get much worse. But I think the crisis in India, as we all know, was of a slightly different kind. In India, the virus seems to be affecting poor people much more disproportionately. It gave rise to a completely different crisis, what we are seeing spilling on the roads now, that of the migrant crisis, all these migrant laborers who were trying to go back home because of the shutdown and they had no means to go back. And it gave rise to an entirely different kind of humanitarian crisis than the one that we are seeing in Europe, or we saw in Europe, which was directly linked to the virus itself. But in this case, this just laid bare India's inequalities even more. I feel that's what I feel as an observer. There were lots of conversations about how India treats its poor, its laborers. Should we have thought about it a little more? What will happen to these millions of people who work in cities? Many of them sleep in factories. Many of them sleep, where they work. And once those areas are going to be shut down, where will they go? And there are no easy answers. I agree with you. There are no easy answers. But the fact is that too many people have died without even having contracted the virus, just by trying to make that Herculean journey. And it's a question that the authorities will have to answer in the times to come.
No, I absolutely agree with you. I think in the past few months, when the lockdown was announced, we saw sort of a lot of people wanted to move back home, and somehow the government was able to convince them that stay where you are. And I think we as a country came together. I mean, even in my hometown, I saw people who were working night and day to make sure that they are provided for, at least food and basic necessities are provided for. But after a while, what the government and common citizens know, we realized that it wasn't about food anymore. People just really wanted to go back home. They said we're okay with staying hungry. We're okay with walking, miles and miles, hundreds and thousands of miles if needed. But we really want to go back home. I think that really, I think India really has seen the invisible workers. These workers were everywhere.
Exactly.
I mean, you saw the scenes that we saw at the Delhi-Noida border every other day, in Gujarat, in Maharashtra. These workers were really invisible, and I had conversations with some of them as I've been trying to help them move from Dehradun to other states and vice versa. And what I saw was there was so much disappointment, especially from their respective employers. There were these contractors who didn't pay the workers for all the work that they'd done in the past months, and they just left. So there's all this labor who's basically almost orphaned because the contractor who was responsible for them has just fled. There were also like factory owners who just sort of, shut shop and vanished, refused to provide. Of course, there have been great examples of, businesses really taking care of their employees. But I think, this has really made no conversation in India ever had migrant workers at the center of it. I mean, even if you look at in terms of policy, I still remember we've been talking about one nation, one ration card for a long, long time. And in 2018 was when the BJP government, currently also in power, started doing the groundwork for implementing it. But we saw that last month, the government announced one nation, one ration card. Imagine if all of these workers were able to access the PDS shops wherever they are in the country, if they had one ration card which they could use everywhere. So I think it has, it, like you said, it laid bare all the inequalities, but also there was no set formula. There wasn't any best practices book anywhere that anybody could refer to. I mean, normally you would look at the West for answers. That's what we've seen in the past, that, you look at Europe and, the Americas for answers. But here, it was completely different. And also because the challenge for us was completely different. For us, it wasn't about, it wasn't just about the virus. It was about our population. There was no way that India could have handled the kind of spread that we've seen in Europe, US. So I think there are a lot of questions that everybody has, but there is no perfect formula for anything. And as somebody who's also politically active, I feel there were moments when I questioned questioned the way we could have done things. But I didn't find myself questioning the lockdown itself, because there have been a lot of theories about that. It could have been planned better. It could have been, people could have been given a few days sort of notice. But I don't think that would have worked. And these are all hypothetical situations. Imagine during if a week's notice was given, perhaps you would have found the same scenes on the Delhi-Noida border, or in Surat, that we found a month into the lockdown. So I think it's hard to say, but I think this virus has really woken us up as a country, and of course globally, and it really shows us that access to healthcare needs to be the priority of every government. And particularly for India, I think I'm surprised that we have been able to do so well considering our healthcare system. And I don't know, like, I'd love to hear your thoughts on why you think this has happened. Why do you think has the spread been contained so far? What are the theories that you're hearing, like, outside of India?
Well, I mean, one of the things is that, how India sort of records deaths is very different from how it's recorded in the West. For example, I think I was reading this somewhere that 80% of deaths in India happen at home, and they are not necessarily always correctly classified as to the cause of the death. So that is one reason that you're not really seeing in official statistics and official numbers. You're not seeing that many numbers related to COVID directly, because a lot of them may have had underlying conditions or comorbidities, and maybe that's what's being attributed to it. But I also think I agree with you that initially it was great that the numbers could be contained, but I do think that the worst may be still ahead. It's not over. We are far from the peak, and again I agree with you that there are no simple answers. There all governments, all regimes around the world are dealing with something like this for the first time in this generation. And yes, one thing that I have felt observing people's reactions in different countries, I mean, I was in Europe, now I'm in the US, and I've been seeing things unfold in India. One thing that I do feel that a vast majority of people, there is this sense of their leaders having failed them in some way or the other. Like, is it that why were they not better prepared? Why was the world not better prepared? Why was the lockdown not enforced much earlier? Why was there not more sort of preparedness to deal with something like this? I mean, at least initially, now things are like sort of settling down a bit, but there was this overwhelming sense of why are world's leaders failing their people, their population. And before I go on to the next point, may I request this other report that I did? This was my last day in Spain, I think somewhere in the beginning of April, when I did this report from outside a hospital.
Let's go to Spain now, and that country has suffered another record daily death toll. 864 people have died in the past 24 hours, pushing the national death toll to more than 9,000. Although there have been more than 100,000 confirmed cases in Spain, numbers show the infection rate is continuing to fall. Here's the BBC's Pratiksha Ghildial in Madrid.
I'm outside one of the main hospitals here in Madrid, where a number of COVID-19 patients are being treated. Now, across Spain, there's a huge amount of pressure on ICUs, which are struggling with the number of patients coming in. Now, in the past couple of days, there was some hope that this pressure seemed to be easing off. But today, Spain recorded its highest death toll in 24 hours. That's 864 people dead in 24 hours. And the number of infections across the country now stands at over 100,000. But the only silver lining in this is that the rate of infection seems to be falling. Earlier this week, Spain's government imposed tougher restrictions on movement across the country. Shops and restaurants remain closed. And now non-essential workers are also being told to stay at home. It's a really difficult time for a society that loves to interact. But a majority of Spaniards seem to be complying with these restrictions. They are only going out to buy groceries or medicines or to walk their dogs.
Pratiksha Ghildial reporting there.
Right. So, like I was saying in that report, that this was the day that Spain recorded the highest number of deaths in 24 hours, until that point at least. And one of the things that I don't know how it's panning out in India at the moment, but one thing that was breaking hearts across Spain was the fact that this virus forces you to die in isolation. It's, if you've contracted it, your family can't visit you, you can't get a hug from your loved one, you can't, see them in person. And that was the most challenging part that's what I felt for many Spaniards, not being able to see and say farewell properly to a family member who might have died because of the virus. As a result, funerals were banned. You couldn't have funeral services. A lot of people were opting for like online funeral services. No proper services were happening, and people were just being buried without a proper service, and that was a very difficult thing as well, because again these are rituals which are important to people there, to be able to say farewell to people, to their loved ones properly. And I think that was breaking a lot of hearts as well. And this is again something which people had not experienced before, to not be able to see your loved ones before they leave the world. And I don't know how that's being received. That thing is being received in India. What do you think, Neha?
Pratiksha, I'm with you on this. I think the reason why people fear this virus, of course, in addition to the fact that it's extremely contagious, is that it forces you to die in isolation. I mean, all of the stories in first-person sort of accounts that I've read, which have really sort of, made me stay at home. I've been out and about for most of this lockdown. We've been running community kitchens and, trying to distribute dry ration and running all sorts of relief operations. But one thing that has got me really scared is the fact that if something happens to me or anybody in my family, we're going to be alone. And I think not everybody fears death, but what everybody would fear is dying alone and not having your loved ones around you. I think that's the brutality of this virus, that it just leaves you all alone. You don't even get a send off. There have been a lot of stories where relatives have refused to cremate or perform the last rites of a COVID patient, and the authorities had to step up. In fact, my organization, we are running a program now where unclaimed bodies and bodies of patients who die or succumb to COVID, we will take the responsibility of wearing proper equipment and cremating those. So we also have organizations coming forward to do that. It just shows you what fear can do to you. So I agree that is the most dangerous and the most heartbreaking thing about this virus. And I think perhaps that is also the thing that is making people stay at home. It's not necessarily the fear of just contracting the virus, because most people I've met have been like, oh, I won't get it. In India, social distancing is hard, almost impossible. I don't think, if I say it's almost impossible, I'm exaggerating. I've seen people not really observing social distancing, even educated people. I ventured into a store, I think about after 2 months, where I had to buy something, and I realized that nobody really was trying to observe social distancing, even though the shop owners had, made markers for people to observe that. So I think everybody is trying to adjust to the new normal, and people who are staying at home are the people who have really sort of read those accounts and understood that if you die due to this, and anybody can, you're going to be all alone. I think that's the worst part about this.
Yeah, absolutely. And that is one thing that was happening in a lot of care homes across Spain. The crisis that we are seeing in elderly care homes in Europe, actually, I think in many ways first started in Spain, because scores of them were dying in care homes. In Europe, there are these care homes for the elderly where people go in their old age and spend time there. They're given food and the virus was spreading really, really fast through these elderly care homes, affecting a lot of elderly people very disproportionately. And in a shocking case, one care home, like elderly people were found abandoned in their beds. Some of them were even dead, as far as I remember. And the care home staff had just left because, the virus was spreading so fast in care homes. They were just so scared. And then the government announced that there will be an investigation into why this happened. Why are our elderly suffering so disproportionately, and why why are they being abandoned like this? So that was again a really heartbreaking moment for the country. Again, not used to seeing their elderly, being abandoned like that in care homes, and that I think it really forced a lot of people to introspect, to think about, oh my God, like what is happening? This virus is just like dividing, uh, communities in this way that you're forced to flee um, where you're supposed to be taking care of them.
Mm-hmm. Pratiksha, one thing that I do want to ask you is, because you were right at the sort of beginning of all this. There was this one particular event, some Women's Day rally that happened in Spain, and I read that a lot of experts there were calling it an epidemiological bomb, where that rally shouldn't have been allowed. And I think it was attended by like a couple of thousand people, and this was when the virus had already started sort of rearing its fangs there. And I heard comparisons in Indian media where the whole Tablighi Jamaat event was being compared to what happened in Spain. Did you hear any of these comparisons, and have there been conversation on this?
Not in the same way. Not in the same way. I mean, yes, there were questions about why gatherings were allowed, when the pandemic was already in full force and had fully arrived, and whether it was necessary to have held that rally, that women's rally, at that point. But definitely not in the way the Tablighi Jamaat event was being talked about in India, where it led to sort of, certain demonization and ghettoization of one particular community. And there were lots of questions on how the media covered that story. Yes, there were questions in Spain about, why gatherings were allowed. And like I said, regimes and and authorities and, governments are being questioned everywhere, because this just hit, this just hit people out of nowhere. And
right, it leads to some sort of structural changes, and which will make us better. I think it's important that these questions are asked. It is true that we've never had anything of this scale or magnitude, and but that's not to say that it's not going to happen again. So, it happened 100 years back. It will probably happen again. Are we prepared for it? Certainly not. So I think it's important that governments are questioned.
Absolutely. And I think this has forced a lot of thinking on the part of authorities, on the part of healthcare workers, how equipped are our healthcare systems around the world, not just in developing world, for another catastrophe like this, forcing a lot of thinking. But also, here in the US, where I am currently, there's also been a lot of there are allegations of a lot of denial on people's part as well, because before the current racial tension started and these protests started, there were another kind of protests where people were going out and demanding their right to sort of not be under lockdown and for the lockdowns to be lifted.
There's this entire movement against not people refusing to wear masks and not allowing people to wear masks, which is bizarre to somebody from India looking at this from outside.
Yes, for people outside of the US, it can come across as quite a bizarre thing and quite a weird thing. But here in the US, and everybody was like, only in the US can, like a pandemic get so politicized, because, while the left is like, oh, we should be careful, we should wear masks, and, the lockdown should be extended. And then there were like, certain people on the right who were saying, no, this is against freedom of, this is against our basic freedoms. We should be allowed to move around. And, I think a lot of them felt that it was being blown out of proportion by the media. So much so that, it was just weird. Yeah, it was like, how can a pandemic be so politicized? But, here we are in the US.
And we saw some pretty dramatic visuals of, doctors and nurses coming out on the street and, almost having a face-off with some of these protesters, which, like you said, to somebody seeing it from outside, where here we've seen an entire, we did the drill of coming out on our balconies and banging thalis and, blowing whistles and doing all of that and lighting diyas to pay respects to our healthcare workers. So to us, I think it was extremely bizarre to see all of these people coming out and the doctors and nurses saying, please wear masks. We can't take care of you if you don't take care of yourself. So I think it's different.
Absolutely.
But,
I mean, the US is so divided at the moment about everything. Past few years, um, every issue leads to like so much of. I mean, there's division in everything. So I'm not surprised there's division even in a pandemic. So it's just a very polarized society at the moment.
I think, before we end, I think even in terms of, the narrative in the media and how it shifts for the past few years, there was a lot of questioning of the whole digital India and, do we, we've opened all these accounts and there's no point because people really aren't accessing them. People don't have money enough to save. But, we saw how that has really helped us mitigate the crisis. I was going through some of the data and, more than 20 crore people have had money deposited directly into their bank accounts because they had bank accounts, which was something, less than 50% of the population had bank accounts just 5 years back. So just the sheer scale of inequality sometimes is baffling. And again, we had this scheme of giving free gas connections to people. And all through these years, I've heard a lot of critique about it, that women aren't able to buy refills. What's the point of giving them connections? They live close to jungles. They can't afford refills. But here, the government was immediately able to provide them free refills for 3 consecutive months because they had connection in the first place. That access barrier had been broken. So, and the media also has woken up to all of that. So I think it also, you don't have to wait for a crisis or really, sometimes even the criticism, I think it gets kind of out of hand. And Indian media in particularly, I feel, has been divided, as media everywhere. It's not an exception, it's more a norm. But we've seen that this has shifted the conversation. I do agree that initially it was, there was the whole Tablighi Jamaat episode, and the conversation briefly was very polarized and divided. But I think going forward, I think people have woken up to the fact that there were all of these issues that this current government has worked on, which has helped contain the crisis. So I think I was reading somewhere, there are all these approval ratings and surveys that are happening, and it was heartening to see that the Indian government and the Indian Prime Minister still, has really high approval ratings, and so far, at least people in the country have largely been satisfied with the way the crisis has been handled. Of course, it's not perfect, and there are 100 things that I can point out which could have been done better. But what do you think? You mentioned earlier that there's a lot of disappointment globally. I think not for particular leaders, maybe, but also generally in terms of leadership. That what have the subsequent governments done to prepare us for a crisis like this? So just to wind up the conversation, what would be your thoughts on that?
Well, before I come to that, Neha, I think one thing what I'd like to say is that, like we were talking before, that this pandemic in India led to a totally different kind of humanitarian crisis where inequalities came out. So many migrant deaths happening on the way when they were trying to make their journeys back home. But what I really hope India learns from this is how to treat their labor class better, how to treat people who are less privileged than us middle class people better. There was a lot of conversation about how people were treating their domestic help and their maids, and if first of all, they are paid peanuts anyway by in India. But because of the lockdown, if they are not being able to go to work, many people refuse to pay them, which in my opinion is really it's just really distasteful. You can't do that. I mean, if there's a lockdown and poor people are not being able to make a living, you as the middle class should rise and support them and make sure that their wage is not affected. So I think to me it like sort of, it really like sort of showed a slightly I would say, ugly side of the Indian middle class and the Indian upper middle class, about how they treat their help, their domestic help, and even laborers. A lot of, it's almost like they're dispensable. Like you were saying earlier, that we don't really see them. We don't want to see them. They should come and do our work, do our cleaning, and then just disappear. And they should make our buildings, they should make our high rises, and they should make our roads and our infrastructure, but not be visible. Show us the shiny India, show us the shining infrastructure, but please don't show us poor laborers. I really, really hope that this leads to a national reckoning in India and people think about this more. You should not be ashamed of your poor. You should not be ashamed of your labor class. You should be proud of them because they are your backbone. They are they are the people who make India run. They are building your cities. They are keeping your homes functioning. Treat them better. If anything, at least the pandemic should teach you this.
I was having this conversation with one of my friends, and I was so surprised to hear that, the conversation was more about how is it there are so many migrant laborers in Delhi. And I was like, you see the number of flyovers that are constructed in Delhi on a monthly basis, the number of building projects that are operational on a daily basis. The guy who sells flowers on the roadside, the guy who sells, chai to you outside your office, the guy who, a cobbler sitting outside, all of them, none of them belong to Delhi. They're all there around you. You probably never noticed and never paid attention, but they're all there. Absolutely. They're the ones who are making your life easy. A lot of conversations, to my surprise, at least in the initial phase of the lockdown, focused on, how people were so wary of not having domestic help. Yeah. And initially, in India at least, the disease started more in the upper middle class.
Absolutely. And, it's the rich who gave the disease to the poor. Let's be very frank about that. Yeah.
It's funny that, all of these people were more worried about having to pay people when they're not working. And like you said, it's not like, we pay our domestic help a lot. So I think it has really also shown our hypocrisy, especially the middle class and the upper middle class, like you said. And I hope that we've realized the value of their labor. We've read about dignity of labor and all of that in our school books. So I don't think most Indians believe in that concept. So today when, and in fact, I have a place in Noida where I was before the lockdown, and we get these emails from society. So they've done a one maid, one house policy after much protest from some senior citizens that they do need domestic help. So I saw that, so much thought is being put into getting these people back. But I do know of cases where people refuse to pay their help when they were not working, or pay their, the car cleaner when they were not working. So I think that is something that we as a society need to wake up to. Well, of course, there is the government's responsibilities in framing policies, but I think as a society, we've failed our laborers. All of the private sector that is employing these laborers, they failed these workers. There have been, like I said, there have been some great stories have also emerged where, I saw certain companies actually gave people a raise or, went out of their way to help their employees. But those stories are, too few to really count. So I do hope that this makes us better as a society. I think we've done a good job in terms of, at least like I can say for my state, in Uttarakhand, I can definitely say that nobody went hungry. There was a network of organizations working all through the state, even when we sent the people back to their respective states, and we tried our best to even persuade them to stay, because we know that once the lockdown gradually starts opening, we're going to need these people here. because you know how migration works. People in Uttarakhand will probably go out and do the same work, but they will not engage in the same kind of labor here in the state. So we need these people, and we tried to convince them. But whoever wanted to go back home, we made sure that they went back in dignity. So I think even in terms of how states dealt with the crisis, the response has been different, as you would expect in a federal structure. But I think just to wind up the conversation, I would say that governments will come and go, but I think as a society, as a nation, even as a, as like a, what are we doing about it? What has each one of us done in terms of reaching out and doing our bit? I think even if you were paying your help regularly for the past 3 months and asking and checking on them, that to me is you fulfill your responsibility as a citizen. You needn't have donated anywhere, you needn't have gone and fed anybody extra, but to think that some people did not even do that bare minimum, I think it really shows us a mirror, and it exposes our hypocrisy, really.
Absolutely. I couldn't agree more, Neha. And just to wrap up, yes, the two main things that I think India can learn from this crisis is, one, treat your poor, treat your underprivileged better, uh, pay them well. Don't expect them to be these invisible people who build your infrastructure and run your households, and then they should not be seen. Treat them better, give them respect. And the other thing is, invest in your healthcare more. India needs to invest much more in its healthcare than it currently does. So I think these are the two main things as far as I can think of for India. Let's hope we become better as people, as a society.
So it has been lovely talking to you, Pratiksha, and I do hope that we've crossed the worst. I'm not so confident when I say that, and we of course bracing ourselves for and preparing ourselves every day, for what may be the worst months, the next 2 months. But I think I'd like to focus on the positive and really hope that the worst is behind us. And I think what I want to do is, again, keep this conversation going, really, talking about migrant laborers, talking about their rights. I think now that the conversation has started, let's keep it going, and I hope we can collaborate in the future to do that.
Absolutely. Very nice to talk to you, Neha.
Thank you so much, Pratiksha. Bye-bye.
Bye.
Bye-bye.